It felt like my head was going to explode all over the room.
I was at rock bottom. I mean, I was totally at rock bottom.
I said, God, this isn't fair. Leave this family alone.
Her life, it wasn't cut in half. It was cut down to 10%, and fast.
Next, 3 medical mysteries that defied the experts. 5-year-old Connor Rowley is plagued with a mysterious fever that won't go away. His doctors can do nothing for him, and his family fears for the worst.
I had one of the siblings ask me if Connor was going to die.
Tom Stampy thinks he has his whole life ahead of him, until a bizarre affliction turns his entire world upside down.
I didn't want anyone to see me like this because I really felt now I'm this freak.
And Linda Vola, an active woman her entire life. In a matter of days, she is overcome with crippling pain and vertigo, and no one can figure out why.
I actually had to help her walk out of the house. This was not the Linda that I knew.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. September 10th, 1993. Connor Rowley is born. 8 pounds, 13 ounces. It is an especially joyful time for his family. Just a year earlier, they were mourning the loss of another child.
We had another son named Chron, and he died from some lung complications when he was about 17 days old. And so when Connor came along the year after that, everyone, all the siblings were just protective of him.
Oh, he's a clown. He's a great kid. I guess you could call him the baby of the family, but he's just one of the gang.
He's very playful, very inquisitive. He's got a very, very special place in my heart.
Connor is a perfectly healthy little boy and gives his parents no worries. Until his 5th birthday, when they notice something strange.
So his friends all came over and we did the cake and everything.
Connor was not himself. When the other kids were playing, Connor would not participate as much as you would normally expect him to do.
Later that night, Connor seems to get worse.
He was sick to his stomach, and then he had a fever. And so we waited a couple days to see how that would turn out. It lingered for a period of time after that.
At first, Chris and Dave assume it's just a stomach bug. But as the week goes on, Connor's symptoms evolve into a weird pattern.
Every day he would wake up and feel pretty good. And then in the afternoon he would begin to spike a fever, and Connor's fevers would go anywhere from 101 to about 104. And then in the evening the fever would break and he would be just drenched in sweat.
There'd be a puddle of sweat on the small of his back, and it just literally, his sheets would be soaked.
I'd never seen that happen with any of my kids before.
It took a little while for us to recognize that this was not the flu. This was something a little bit different.
Chris calls their family doctor and describes Connor's symptoms. He says it's probably nothing to worry about, but tells her to watch Connor carefully. 5 days later, Connor is no better. In fact, he's worse.
He would have severe tummy cramps several times a day. It was so severe that he couldn't even stand.
He would be doubled over in the fetal position on the floor. It's heartbreaking to see a child at that age curled up on the floor.
It didn't get better. He didn't show any sign of improving, so my mom alarms began to go off.
This time, Chris takes Connor in to get checked out.
The doctor was thinking in the beginning that Connor might have had a parasite or a bacterial, so they did a blood draw.
While they wait for the test results, Connor is put on an antibiotic, just in case.
All the cultures came back negative. They didn't see any bacteria that they could find or any parasites.
Their doctor is mystified. To be safe, he keeps Connor on the antibiotics for a few more weeks. But the 5-year-old doesn't get any better.
I could be at the grocery store with him and he'd suddenly just bend down and lay on the floor.
It got to a point, honestly, that Connor could not even, walk 100 feet without getting tired. You could tell he was wearing down. And you're wondering what's going on inside this boy. And it was quite a mystery.
Eventually, it gets so bad that the Rowleys are forced to pull Connor out of school. Over the next 3 weeks, his painful symptoms persist. Stumped, Connor's doctor refers him to a pediatric specialist, Dr. Scott McKercher.
Whenever a patient like Connor has fevers for a while, you start wondering, okay, is this something simple like a pneumonia or a sinus infection or a bladder infection, or is there something else brewing? And I said, you know what, we need to look for some more unusual things for this fever.
Dr. McKercher orders dozens of tests.
He took a lot of blood from Connor, and we were not prepared for that. We were just shocked. They took 8 vials of blood.
We looked for just a variety of different things. We looked for lupus or rheumatoid arthritis. We did some tests for typhoid and paratyphoid, which are bacteria infections that can sometimes cause unusual fevers. And unfortunately, really all of those tests came back normal.
Chris's frustration begins to grow. She can no longer just sit by and watch as her son gets worse and worse.
She would spend then the late hours at night doing the research, keeping more logs, keeping more notes, finding out anything she could about anything she heard a doctor mention, just so she could try to better understand what might be going on.
We found out that night sweats are a sign of some of the different chronic diseases, things like cancers, things like juvenile rheumatoid arthritis. And so it made us all very alarmed.
In the meantime, Connor is virtually wasting away. In the 2 months since his symptoms first emerged, he's lost 10% of his body weight. The Rowleys feel like their son is dying right in front of their eyes. Racked with worry, Chris and Dave pack Connor into the car and drive 170 miles to a research hospital for a complete workup.
My largest fear for Connor was that he would have cancer, quite honestly.
They had all kinds of people seeing him. They had GI people, that is gastroenterologists. They had infectious disease people. They had hematologists or blood doctors take a look at him.
You know, we just had to eliminate all the things that he didn't have.
Connor's severe stomach pains raise suspicion among the new team of doctors, so they order a series of gastrointestinal exams to get a picture of what is going on inside the boy. First up is a barium X-ray.
A barium swallow test is trying to take a look at how fluids goes through your intestinal tract. So they take an X-ray, so you're getting the liquid going down your esophagus, and then you're watching it splash into your stomach through into the intestinal tract.
But the results of the barium test are inconclusive.
It showed that in the upper part of the intestine there was just some prominence of what they call the folds, which is kind of the lining. It was really pretty nonspecific though. The rest of his small bowel series they interpreted as being normal.
Connor's hospital stay stretches on for 15 days. Finally, all the blood has been drawn and the poking and prodding is over. The Rowleys are on pins and needles waiting to hear the results.
Everything came back negative. And so they told us that that was the last thing they could do for us.
We were told that he should go back home, see what manifests itself over a period of time, whether it gets worse or gets better.
Chris and Dave are crushed. They make the 3-hour drive home with their 5-year-old son, who's mysteriously getting sicker every day.
I had one of the siblings ask me if Connor was going to die. And at that point, we didn't know. But yet, for the kids, having lost a brother, they were already preparing themselves to lose another one.
Five-year-old Connor Rowley has seen dozens of doctors over the last 5 months, but none of them can explain his chronic fevers and frequent agonizing stomach cramps. Desperate, his parents reach out to their community.
I decided that I needed to somehow document where we had been, and I needed to figure out how maybe getting some more public input might help shed some light.
Chris wrote an article on Connor. It was a great way for us to get his name out there and try to draw some attention.
The article runs in the Des Moines Register, Iowa's largest newspaper. It catches the attention of pediatric gastroenterologist Dr. Warren Bishop.
I was reading the Sunday newspaper, and I came across an article about a young child who had been having mysterious symptoms.
By chance, Connor is referred to the University of Iowa hospitals, where Dr. Bishop works.
Connor was very, very anemic. He didn't have enough red blood cells, and that made him pale and weak. And the question was, where could that blood be going? He wasn't having bleeding from his nose or coughing up blood, and that really meant that most likely the blood loss was a subtle blood loss through his intestine.
When we arrived in Iowa City and met Dr. Bishop for the first time, he told us that he had read about Connor, and he immediately said, it's Crohn's. And I took a step back because I'm thinking, who is this guy? We've been through all these tests, we've looked at all these biopsies. How can he be so confident that it's Crohn's?
Crohn's is a chronic bowel disease affecting at least 1 in 14,000 people. With Crohn's, the body's immune system is overactive and can mistake harmless bacteria normally found in the intestines for foreign substances. White blood cells invade the lining of the intestines, where they cause inflammation. Left untreated, Crohn's can lead to ulcers, infection, and even death.
The daily fevers, the abdominal pain that he was having, and then his anemia. I think all those factors together made me really think about Crohn's disease.
But there's one key factor that does not add up. Crohn's sufferers usually have severe diarrhea, a symptom that Connor never had. Nonetheless, Dr. Bishop is suspicious. He consults with Dr. McKercher, and they decide it's time for another barium X-ray. Right away, it's clear that in the 7 months since the last one was done, Connor's intestines have changed dramatically.
This one showed a narrow spot in the upper part of his small intestine that strongly suggested Crohn's disease.
But the location of the abnormality could also be a sign of something far scarier for the Rowleys.
It was in an unusual place for Crohn's, but it was in a place that intestinal lymphoma can occur.
Lymphoma is a type of cancer that originates in the lymphatic system, but can attack any organ, including the small intestine. While Crohn's is dangerous, lymphoma is a killer. Now more than ever, the Rowleys are in a race against time to get an accurate diagnosis.
We needed to go after that segment of intestine in the middle of his bowel that was too far away, too far down to reach with an endoscope. And so the approach then had to be surgical.
On October 9th, 1999, 1 year after his symptoms began, Connor is wheeled into the OR for exploratory surgery.
We hadn't been separated very much during any of the hospital's procedures, and so it was scary to just watch him go.
We were very nervous, very scared. We also knew that in order to really find the answer, this was the way to do it.
During the 2-hour operation, the surgeon examines all 12 feet of Connor's small intestine.
The surgeon found that segment of intestine was very thickened and red and angry looking. Connor also had enlarged lymph nodes associated with the inflamed portion of the intestine.
The inflamed lymph nodes are a sign of lymphoma, but the surgeon sends a tissue sample down to the lab to be certain. While he waits for the results, he steps out to talk to Chris and Dave.
The surgeon came down and told us that they suspected it was lymphoma. And that was a real shocker. We were devastated. I mean, we were scared to death.
First reaction is you just want to cry. Just leave me alone, cry. But how could it be that it took this long to get there?
Chris and Dave Rowley are in agony as they sit outside an operating room waiting to find out if their 6-year-old son, Connor, has Crohn's disease or cancer. His surgeons have taken a biopsy, and now they've gone back into the OR for another look.
They actually had to take the intestine out and look at the whole intestine and inspect it by hand all the way through.
Within the hour, the results from the biopsy are back, and they're shocked by the finding.
The biopsy showed no evidence of any cancerous tissue present. And it was a tremendous relief to me that this really was not lymphoma. And we could go back and tell the parents, you don't have to worry, Connor's going to be okay.
I don't remember the surgeon's exact words, but the sense of it was that it wasn't lymphoma, that we did not find malignancy, and we believe it's Crohn's. And it was good to get the lymphoma fear entirely off the table. So we finally got that definite diagnosis.
We told Connor that we had an answer, that it was Crohn's disease, and that it was something that we would learn about, and that we could start treating him for it right away, and that he would start to get better.
The only thing I remember is when I came back after the surgery, they had welcome home banners everywhere. That was pretty cool.
After months of questions and helpless waiting, the diagnosis of Crohn's comes as a tremendous relief. And it's not a moment too soon.
If Connor had not been diagnosed when he would have gotten sicker. And eventually, he probably would have required surgery for a bowel obstruction, because that narrow part of the intestine was getting narrower and narrower, and the intestine can literally scar shut.
The Rowleys learn that Connor's intestines haven't sustained such severe damage. His Crohn's can be kept at bay with powerful anti-inflammatory drugs similar to aspirin.
He's on daily medication even though he's not sick, and the purpose of that is to prevent flare-ups, and it's working. He's not had any flare-ups at all.
Connor is doing fantastic. He's a regular 11-year-old boy. He's on the baseball team, he's on the football team, he likes sports, he's active.
We've essentially had no symptoms now for about 5 years, and that's been wonderful. They consider his Crohn's in remission.
But for an ailment that afflicts so many people, Chris and Dave had to wonder why no one could identify it earlier in Connor.
The Crohn's disease only revealed itself upon repetition of some tests that had already been done several times. So it made it easier to diagnose as time went on.
Go deep. I'm gonna hit you there.
We learned over and over again that you can't really make a diagnosis in a vacuum. You have to really work at it.
Nobody knows all the answers, but if you work together as a team and work towards finding that cure, that can be very powerful.
Connor Rowley was very young when he first fell ill.